We're the very first hospital in the state of Arkansas
to be recognized as a magnet hospital.
What we have achieved is what people are striving to achieve.
A magnet hospital is a center of excellence.
It provides a sense of security that they're receiving the best nursing care available in the state.
We're moving forward and taking this facility to a whole new level.
There's just very few hospitals in the world that are magnet hospitals. And as far as nursing goes in Arkansas, this is the best.
Back, you've probably seen the television commercials for medication for restless leg syndrome, or RLS. So what exactly is RLS? Well, Dr. Morgan Sauer with the Longevity Center at St. Vincent, is here to tell us more about RLS today and kind of describe what it is, Dr. Sauer, about what is RLS to begin with.
Restless leg syndrome, a little difficult to say this morning.
It is tough to say pretty fast,
I know it. It's actually a neurologic disorder. A lot of people complicate it and say it's a sleep disorder, but it's actually more of a neurologic disorder. And it typically occurs at night, but certainly can occur during the day and can really make people's lives miserable.
When you say, exactly what causes it, what are some of the factors that are brought about on the causes of restless leg syndrome?
Still, a lot of people don't know, science doesn't know exactly what the problem is for everybody. There appears to be a genetic link because we know it can be inherited within families. Not a guarantee, but a higher percentage of people are going to get it if it's in their family. Additionally, we know that iron has something to do with this. There's an abnormal utilization of iron. Low iron
not a deficiency, right? Just a
people who have iron deficiency can certainly have this problem. But even if you replace some of them, the symptoms don't go away. So if you have a normal iron level, but your body can't utilize the iron normally, we think that's where the problem is.
Let's talk about some of those symptoms. How would someone know if they have this, or know if one of their family members maybe has this?
Ask your spouse or whoever watches you sleep. That's the number one, because they're usually getting kicked from this. So they'll be able to tell you first. Usually what happens is at night, their legs will move, almost like a running motion, constantly in motion at night. This can happen some during the day. There can be an uncomfortable sensation. If I just don't move my legs, this really hurts. I've got to move. It's almost like a compulsion, but there's a physical component, not a psychological component. This can cause people not to get good sleep, and a lot of the symptoms that we see that people come in, I'm tired, I'm fatigued, I'm depressed, I have anxiety, I'm just not sleeping well. So it even may be diagnosed as obstructive sleep apnea. People are stopping breathing at night, but no, you're just not getting a good rest because you're running in bed all night.
Okay, so even while they're sleeping, their legs are moving at that time.
Completely unconscious and going 90 to nothing.
Wow. Okay, we just showed up the font. We can bring that up one more time. Some of the problems that are associated with restless leg syndrome. You talked about a couple of them already. Nothing that seems to, other than maybe depression and insomnia, nothing too serious other than those two, but at the same time, you want to get this checked out, right?
You do, and the slowed thinking component can be very scary. All seniors are afraid of, oh my gosh, do I have dementia? Well, if you don't get a good night's sleep, you're not going to think well. So no, it may not be dementia. There's other things that can appear to be dementia that you need to tease out, and this is one of them.
Talk about some of the tests that people can go through to maybe find out if they have this issue.
Unfortunately, there's not a great test like a blood test. You're anemic, yes or no, or you have abnormal levels of potassium, yes or no. This takes a good history from your physician, a good physical examination, and to rule out other things. So definitely needing to check iron levels, ferritin levels, which are involved in iron, and looking at things that can cause neuropathy like B12 and folic acid can sometimes get confused with this.
Talk about any types of, I guess, relievers of this, anything that can help maybe make it go away, maybe cure it, if it can? Yes,
there are things that are available. Some of them are actually generic and very inexpensive. Medications that we use for Parkinson's disease, nice and generic and can work well. Additionally, there are some name brand medications if the side effects from the generics are intolerable. Additionally, physicians may prescribe sleep pills. Fine, your legs are going to move. If the physical symptoms aren't that bad, let's just get you the quality rest that you need so you can actually live and function well.
See some of their, exercise, warm baths.
Anything that can stretch the muscles out, to relax the muscles, stretch the tendons, to provide the physical relief to the legs can be helpful as well.
Okay, some great tips there. Thank you so much for coming in. Dr. Morgan Sauer with the Longevity Center at St. Vincent. You can always call them. We have that information right there on your screen. Great to see you, Dr. Sauer.
Great to see you.
See you next time. Thank you.